preliminary work. It is a work in progress, and I would really like your interventions at the end of this to help beef up and improve this work. So I will skip most of what I had on my slides. The introduction was talking about gender. We all know that gender is a behavioral and social concept as opposed to the biological concept of male and female, and how the unequal opportunities that women and girls, men and boys are exposed to affect their opportunities and chances in life. So that's in the vein in which we'll be looking at gender. If you can just hold on. Now, gender determines how one can be exposed to HIV because it affects your vulnerability. And gender is therefore important because it determines an individual's risk of contracting HIV. It also determines how an individual can access diagnosis, care, treatment, HIV and AIDS. Men and women will react differently on accessing this. And also the consequences to the individual on being diagnosed with HIV will be affected by your gender. The consequences you assess there too and your risk of contracting it. And then the onset and progress of the illness is also affected by the gender. Certain gender have quicker onset and quicker progress of the HIV because of the gender. Then the impact on the individual's HIV-related illness and death on the family and community is also affected differently depending on the gender and age of that child. So gender is a very strong determinant in the HIV/AIDS work, and therefore must really be looked into when we're coming up with legislation, policies, and strategies around treatment, management, and actually legislating HIV. So that's the background against which we are doing this gender audit, because gender is very, very crucial, and it's a great determinant in how gender impacts, HIV impacts on the various gender. So looking at the legal issues around gender and HIV, looking at the legal issues around gender and HIV, the first one, the slides are not moving in time with me. The first issue is disclosure, notification, and confidentiality. Now we find that disclosure, notification, and confidentiality is provided for in most laws, but this impacts differently on different gender. Because of the unequal relationships the people have, you will find that we live mostly in East Africa in a patriarchal society, and therefore most homes are headed by the male and not the female. And therefore, if it is the female who has first notice of the HIV contamination, and the notification is to the male spouse, the effects of that notification have great ramifications on the entire family, on the woman, on the children, and the community. So this partner notification legislation should be aware of these issues before we legislate about it. How can we go about it? We've talked, my colleague talked of instances of death. Death leads to orphans. Orphans leads to poverty. It's a whole cycle, it's a whole chain. So that we need to be very, very alive to these factors when we are legislating. When you talk of partner notification in a polygamous scenario, who is my partner? Is the 10th wife my partner? Is my husband my only partner? So who will be notified? You know, those are issues we need to think about when we're talking about gender and notification. When you're talking about partner notification, who is my partner when I'm not married? How far back do you trace my partners? And how do you deal with partner distress if you give me information that my partner has HIV and I'm probably not affected? How do we deal with the distress level? So these are all gender issues around notification that we need to think about. And whether then we should be allowing across-the-board notification or whether gender consideration should be taken into account. And all that ties in with disclosure and confidentiality. When we talk to disclosure, again, we go about issues around criminalizing not telling your partner. Again, what are the effects of a penal sentence? It again affects the whole community. In most instances, it will be the woman who is first getting notice of the HIV status, especially when we have this screening of pregnant women. So if I, the woman, am taken to jail because I didn't notify my husband, and it's a criminal consequence, what happens? The ramifications, again, are all tied down to the entire society. So all these issues, the gender issues around notifications, disclosure, confidentiality that we have to be alive to when legislating issues around HIV and AIDS. The second area is the risk of contamination, which again raises issues around gender notification. Risk of contamination comes in various ways. We have a lot of home-based care. And the burden of care, we know, in a home-based situation lies on the female more than on the male. So that when there's a patient in the house, the person who will be having close access to the patient will normally be a female caregiver. There are very rare instances in a home scenario where the caregiver is male. And therefore, we need to ask, how do we protect these caregivers from contamination? And this, again, is a gender concept that has to be taken into account when we're legislating about home-based care, palliative care, and issues like that. Again, we have traditional birth attendants, nurses, and other medics who are exposed to the risk of contamination. Again, we know TBAs and nurses are mostly of one gender vis-a-vis the other. And again, those considerations and constraints come into play when that happens. I know there's a lot of legislation about gloves and things like that. But how many rural area hospitals have gloves? How many traditional birth attendants can actually fail to expose themselves to the risk of contamination? So those are issues we have to think about. Then there's the issue of access to condoms. Again, a gender concept. If I am earning 100 shillings, I'm living on less than $1 a day, will I spend 20 bob on a condom? Or will I expose myself to contamination? If I have a sick child, will I buy a condom? Or will I treat my baby? Again, gender consideration around access to condoms and vis-a-vis cost. Again, when we talk about access to condoms, I think we need to get to think about the female condom that has been developed. How practical can it be used, and how well spread is it? How well marketed is it? Again, access to condoms, a gender issue arising from there. Then we have circumcision, both of males and females. Around the male circumcision, there has been scientific data that circumcision kind of reduces the risk of contamination. And so some states are moving towards mandatory circumcision. Again, an issue we have to be alive to, sensitive to, and think about when we're doing that. Is it 100%? Should circumcision of the males be mandatory? Will it be clean? Or will there be risk of contamination at the time of circumcision due to shared knives and unhealthy situations? Again, we need to think about that. And with female circumcision, we know there's a 100% possibility of exposure to contamination, another issue. And then post-exposure prophylaxis, the treatment given if you immediately upon contamination. Again, we need to think of how widespread this can be within the countries, because as we see from the first items about that, there's great risk of contamination among the various genders. So it's an issue that comes in there. The third issue we can think about is discrimination. Discrimination against status. Status goes with stigma. The other day I was just reading a press where some women cover their faces and only leave their eyes. They do that Muslim kind of dress when trying to access treatment because of the stigma, the discrimination. So you don't want to be seen walking into an HIV treatment center or a VCT testing place, so you cover yourself up completely. So what can we do around this? How does this impact, and why is it that women cover themselves up completely when accessing treatment? Is there a gender connotation? Is there a way we can deal with it? Is there a way we can have private testing away from public places to protect against this discrimination on status and stigma? Because if I'm even scared of going for testing, then I will not go for treatment. And it impacts on the whole scenario and involves a reform. So it's a big gender issue, and we need to think about how do we deal with this. Discrimination is something that is person-centered and may not be easy to legislate against. But it's there, and so we need to think around it and legislate in ways that are innovative and can therefore deal with the discrimination and its effects. In the workplace, we all know that, I don't know how many of you would probably employ a house girl you know had HIV, for instance. I'm not sure. When you have a little baby, I don't know how many of you will keep a nurse who you know has HIV. I mean, these are issues we regulate, but how do we deal with it? How does it impact on the gender? What is the practice on the ground? How can we then innovatively work around these issues to protect against such discrimination, yet again protect against risk of contamination on the other side, so that we are balancing the both sides of the coin and being alive to that fact. Treatment, again, sometimes there's discrimination for treatment, and sometimes some of this is based around cost of drugs, and then there's a balance in the home. Who needs to be treated more? Who needs to access treatment fast? If you're left with one tablet and you and your partner both will ill, who will take the tablet? Those are issues we have to think around, and therefore make sure that discrimination to treatment doesn't arise, and we can both access equal treatment and get that done. Travel and immigration, those are discrimination.